Hello and welcome to our seventh weekly regional report out call. Today is January 26th and we're talking about Southeast Kansas. We're here every week at 4:30 talk about what's going on with coronavirus and our response as a region and as a state to what's going on. We'll go through a lot as we similarly do. I'll read through the dashboard and then we'll hear from Destiny from the public health side, and then we'll kick it over to Bruce from the hospital side and his special guest. We have Dr. Watson with us again to talk about hospital transfers, and we have our very special guest joining us, Dr. Marcy Nielsen, who is in her first full-time week with the state as the, I want to make sure I say it right here, Chief Advisor for the COVID-19 Coordination. Like the C's, that's good. All right, let me kick it here. So we have a lot to talk about. And we're going to try and get you a lot of good information on vaccine as we have it. And Dr. Nielsen is our vaccine expert. Let me start with our dashboard here so you can all see it for Southeast Kansas. One clarifying thing I want to point out. So we've talked about staffing here. It really was a critical staffing shortages, was a big deal in December and early January. And that number has gotten better. But it doesn't mean that we're not having staffing shortages, or that we're not asking a lot of the people working in our hospitals and healthcare system. So I just want to make sure that we're asking hospitals to report when there's critical issues. As you can see, there's 18% or 2 of the 11 hospitals are having critical staffing shortage issues. But we are asking a lot of our nurses and others to take on more hours and more patients than what they normally would. So it doesn't mean that 92% of the hospitals are out of the woods, or 82% there, sorry. Let me come into the stats. When I look at hospitalized, confirmed, or suspected COVID patients, just looking back over the last 3 weeks, I like the trend here. We had 55 in the region 2 weeks ago, 51 last week, and 40 this week. That's good news. ICU COVID patients, 13 2 weeks ago, 17 last week, 8 this week. Again, that's a fluid and dynamic number, but that's moving in the right direction. Available adult staffed ICU beds, we had 8 last week, 12 this week, which gives us 38% availability in the region right now. This is good news. Even probably a bigger deal is that we're seeing now for 4 weeks in a row, the case count, the weekly case count declining. 1,500 4 weeks ago, now down to 645 this past week. Point out another piece of good news as that goes. This is the positivity percent by region that the KDHE puts together for us. And so when we look at Southeast Kansas, ignore these last set of bubbles. This is as they kind of come in. This is what's captured from the previous week. 7.35% is the positivity rate. You really have to go all the way back to September, late September, early October before you see numbers like that. So that's good, Southeast Kansas. The mitigation efforts, the things you're doing are working to help slow the spread in the region. Now that's stats and that's numbers. Let's hear about it from real people that are on the ground making it happen. And let's kick it to our friend Destiny Wheeler in Wilson County to tell us what's going on there. Destiny?
Hi, everybody. Thank you. My name is Destiny Wheeler. I'm the Wilson County Health Department Administrator. We are all about vaccines right now. Our numbers, like you said, like we just saw, are starting to decline. So that's fantastic. We're getting a little bit of breathing room, able to kind of relax a little bit and shift focus over toward getting our vaccine distributions and getting that vaccine in arms. So we're really excited about that. Unfortunately, our allotments continue to be pretty small, like most counties in the state. And I think we're doing a really good job here of prioritizing our most vulnerable and most exposed populations. And I know that every county has kind of a group that's deciding those things. So it doesn't look exactly the same, but we're all working within the same framework, which is really exciting. So that's basically what we're living right now.
Destiny, can you can maybe speak for Wilson County, or do you know if the other counties, if someone is wanting to get their name on a list or anything, are you guys taking names in your county? Do you know what's going on in some of the surrounding counties as that goes?
In our county, we have 3 providers that are making lists right now, both hospitals and the health department. I know that someone in every county is making a list. I would suggest that people call their own local health department because it looks a little different in every county. So if they aren't keeping a list, they should know who it is.
That's good, Destiny. And we've been telling people check your county health department's website first, Facebook page. And if you can't find the answer how to sign up there, then call, as they are getting a high volume of calls, as you might imagine.
Yeah.
Yeah, go ahead.
I was going to say, I believe the KODE has been playing it on their on the news as well for Southeast Kansas and the 4-state area, the corner there. So
that's great. Thank you. Now let's hear what's going on from the hospitals from Bruce.
Sure. Thanks, John. Bruce Witt, Chief Advocacy Officer for Ascension Via Christi in Kansas. You really are same thing for us. The trends are definitely looking positive. Our inpatient numbers are down in all of our hospital facilities. I know our hospital in Pittsburgh, earlier today, they reported 13 COVID patients, and about a week ago, they were about double that. So definitely looking positive. We also have a lot fewer staff that are out with COVID right now. We're seeing a good positive trend there as well. So kind of the same story from our end, but I've also invited Dennis Franks, who's the CEO with Neosho Memorial Regional Medical Center, and wanted to have Dennis come on and kind of talk about your experience at your hospital, Dennis.
Thanks, Dennis.
No problem. Okay, so
we're having a little trouble hearing you. I don't know if you can get closer to your mic.
Okay, can you hear me now?
Yep.
Okay, great. I'll just give you a little rundown. We're having no staffing issues right now. At the very start, and for a long time, we were having staffing issues because of quarantines and those kinds of things, but that seems to be going away quite well. We have today's census is 18. We've been using a lot of the monoclonal antibodies with very good outcomes. So I don't know if y'all are doing that now or not, but it's working quite well for us. We're working with our public health on a mass vaccine program that we're about to get into. If everything goes well and we get the vaccines here, we're going to really hit it hard. Our numbers right now, we have 53 active. We have 1,453 recovered. We've had 18 deaths for a total of 1,524. And our biggest problem, I would say, in Neosho County has been masking and social distance and that kind of thing. So we're working that hard too. We're doing education programs that we're getting out there, and also working with public health on that to try to get a bigger scene on that.
That's great. I've heard some concern on previous calls actually about football watch parties to cheer on the Chiefs, and that may be they've tied that to a couple spreading events. Yes. And we all know there's one more big game left, so it's good to be cautious.
That's right.
That's good. Thank you, Dennis. Anything else you'd like to share?
No, not really. I mean, we're doing everything that we can possibly do. I think another thing that we had early on, we went through that stage where people didn't really realize how bad it was until they started taking care of the patients. And then we had some issues, emotional type things. And again, we got through that. So, and I'm sure everybody else had some of that too.
Yeah. We appreciate it. Thank you. That is the real human side of it. I mean, you are taking care of other humans that are in really acute, kind of critical space. And I think we've been hearing from everybody, they've had to deal with more death than what they were ever used to dealing with inside of their systems and facilities.
That's right.
I'm going to pass it over to Dr. Watson here from Cheyenne Mountain Software. They have the software that they track the transfers across the state and help patients find the hospitals that they need to get in. Dr. Watson, can you give us an update of what you've been seeing?
Yeah, great. Well, a lot of the same that everyone's talking about, a lot more capacity in the system. We've never seen in the last few months this limited amount of red. Usually we have almost all red with a little bit of yellow, but a lot of normal capacity showing up in different places, particularly at the regional level, which I think is encouraging across the board. I think for Southeast Kansas, I think the interesting parts here are that of the transports that we get requested, 80% are looking for beds. So we're obviously getting the bulk of the people when they're having difficulty finding placement, and only 40% of those are actually COVID suspected, which I think is very intriguing, meaning that still you would think the majority of bed finding problems were actually COVIDs. They're really not. The majority are actually normal type things that there's still difficulty in the system finding beds. They tend to be older. We're talking in the upper 60s, and they tend to be sicker. Acuities of 14, that's pretty high. The wait times are still a little protracted. We know Kansas City's a bottleneck at some points. Wichita is a real bottleneck. We know Oklahoma, Texas, Missouri also having their problems. So we're not out of the woods here yet. And I think the most encouraging thing, John, was that initial graph you showed where for the first time in weeks and weeks, the case count was 50% off the peak, which I think is a real critical number. When you finally drop below 50% of your peak, you're able to start to say that we're approaching some recovery. So even when the system starts to let up a little bit, you still end up being weeks away from being out of the woods. So great news all the way around. I think it does speak to how hard it hit Southeast Kansas and how late that happened as opposed to some other places. So you guys are really holding it here the longest of anybody, and good work by all.
Thank you, Dr. Watson. Appreciate that. I'm going to pivot over to vaccines now. And Dr. Nielsen, as I set her up, I want to come to the website we talked about last week. They've retooled it a little bit, and I just want to share it again. So when you go to kansasvaccine.gov and you click on data here, up comes the state dashboard on the vaccine. And if you're curious and want to see, so you can see the number of people vaccinated, first and second doses administered, the doses as they're coming into the state. This is a good one here, percent of the state that's been vaccinated. We were 3.5% last week, 4.5% now. And then you can see kind of the census of those that have been vaccinated by age, by gender. You can see Pfizer and Moderna. Pfizer had a head start by a week. And then you can see as the people are getting vaccinated by week, first and second doses by day even here on this chart. They've added this one. I think you'll find it interesting. Number of doses distributed by county. So you can see, what the different counties around the state are getting. I know Crawford's in this region there with 400. Looking here at Wilson County, getting 100. Whoops, sorry about that. Getting 100. The frustrating thing, I think, for everybody is there's higher demand than there is supply right now, which is creating frustration out there. We believe in the state that there's 800,000 to 1 million people in phase 1 and 2 out of the 3 million people that live here. And that doesn't obviously include kids. So the total vaccinated, even higher, or vaccine eligible, it's a higher percentage. And we're getting on average 45,000 doses a week into our state. So you can do the math when you think about 800,000 people or 1 million needing to get vaccinated in phase 2, and we're getting 45,000. And that's what you're getting in every county across the state. You have more people that qualify in phase 2 that want it than we are having supply. And so people are doing the best they can with that reality. And Dr. Nielsen gets the honor of trying to help coordinate that and communicate it across the state. And we're grateful for her committing the time, because we know she's very busy being here with us to talk a little bit about the vaccine. And Dr. Nielsen, I may ask you first, just talk about, when you get those 45,000, how's the state determine where to allocate that and where it should go?
You bet. Before I launch into that, John, I wanted to thank you for your leadership in hosting these calls, and I want to thank everybody on the Zoom who has been participating. I see my old friend Bruce and Destiny. I don't want to creep you out or anything, but I want to reach through the Zoom and give you a hug. All the folks who are working so hard in local public health departments. This is really, really hard work. We have folks who are so isolated and anxious and desperately want access to this vaccine. But as John points out, there's a shortage. And so what you do in those circumstances is what we have done across the world, which is we prioritize the populations that are at the highest risk of illness and death, and they get the vaccines first. But it is an imprecise science, and we are balancing risk and ethics and sort of who we are as Kansans. We want for certain to take care of healthcare workers who are taking care of us, and the most vulnerable who live in long-term care facilities who are at the highest risk of death. And that's who we've taken care of in phase 1. And we still have a little bit of work there to get everybody vaccinated. But as we move into phase 2, and John, you probably thought, is Marcy ever going to answer my question? As we move into phase 2, the decisions about who we vaccinate start to get a little more complicated. The populations were focused on individuals over the age of 65, those who live in congregate settings, and those who work in jobs that put them in great contact with people who might have COVID. So those are the 3 buckets of people, but they live all across the state. And as you might imagine, to define each of those categories, particularly around occupations, is pretty tricky. And so in partnership with our local public health departments, we set those guidelines out. And rather than in phase 1, where we were able to sort of count the number of healthcare workers and the number of long-term care facilities, it's kind of a straightforward bit of work to do those estimates and then send out vaccine. Here in phase 2, it's a bit more mathematical, where you put a bunch of variables into basically an equation and see what does this mean for each county? How many doses of vaccine do we send, with an eye toward, because of course we're a rural state, making sure that every county gets some vaccine. So that was the process that we used last week. That algorithm, that mathematical formula, took into account geography, population. It took into account providers that are able to vaccinate and interested in vaccinating, but also do those providers have access to ultra cold storage freezers, because we know that the Pfizer vaccine requires that. And then we also take into account what the CDC calls social vulnerability, and they've got an actual index that tries to factor in who's at a disproportionate risk of getting COVID. We know that that's the case in communities of color. Those are the folks who are often at highest risk based on the kinds of jobs they have, pre-existing health conditions, etc. So we factor that in as well. And all of that goes into the allocation decision. But John, back to the point you were making earlier, if you've got somewhere around 1 million folks who need the vaccine, but you're getting on average 45,000 doses a week, it we can't vaccinate everybody at the same time. What we can do more of is what you've already shared. We can share more information in a more timely fashion, having that dashboard that lets folks know, here's where the vaccine is going, here's who's getting vaccinated. The federal government will be providing what they're calling vaccinefinder.gov that will help individuals actually sign up and get scheduled for their vaccine, but it's not ready yet. And it's not going to be ready for several more weeks. And so the state will be launching a map that will help individuals locate who in their county is providing vaccine, and then provide some information about that provider, their website, their phone number, whether, the hours that they're open, whether they have an online scheduling system, et cetera, all to help Kansans navigate this system. It won't quite be the same as Vaccine Finder. It won't, it will send you to a link that might allow you to do online scheduling. Mostly, we just ask people's patience and understanding as we do everything we can to try to get everyone vaccinated.
Thank you, Marcy. So, while we have Dr. Nielsen, Bruce, Destiny, Dennis, Dr. Watson, any questions that you'd love to ask her?
This is Dennis. I have a question.
Yeah, go ahead.
My question is, of course, I know a lot of other CEOs, and I've talked to them, and our own what's happening here at Neosho Memorial is that we're probably somewhere between 55 and 60% vaccinated now. The other 40% have said, not right now.
Mm-hmm.
Are you seeing that pretty much all over Kansas?
We're seeing it all over the country. And I'm really, really glad that you brought this up, because right now we're very focused on the supply and demand, all those folks who want to get vaccinated, but we absolutely have to keep communicating to those populations who may not want to get vaccinated, and to do our part to explain the safety of the vaccines, to ensure that folks understand where these vaccines came from, and they have every bit of information they need in order to make an informed choice. As I think everybody on the phone recognizes, we need about 70 to 80% vaccinated in order to get herd immunity. And that will become increasingly important as these new variants of COVID pop up in Brazil and South Africa and Great Britain. The importance of getting vaccinated just really can't be overstated.
Yeah, some of our hospitals are, well, like there's one right here, they're paying $300 a shot for folks who haven't gotten their shots yet.
Well, and we do want to make sure everyone understands the vaccines are free, right? The facilities can charge an administration fee, and insurers, of course, can be picking up the tab, but it is clear that what Congress intended is that no one should have to pay to get a COVID test if they've been exposed or they're symptomatic, or for a vaccination.
Yeah,
And he's talking about incentivizing them with
right.
a $300.
Oh, yeah. Brilliant. Yes. I have to tell you, as somebody who has 2 public health degrees, it's really important that we not let people feel coerced, right? We want to convince them with the data and the importance to their own health and the health of their families. But incentives that aren't coercive, we all need to just get creative.
Yeah, that's what we were thinking. It's a little rough though, because you have the people, the 55% that did take it, and those kinds of things. And then, you know, a lot of people who can't take it, what are you going to do with them? So it just, like everything else we do, it goes on and on for a while before you figure it out.
Yeah,
Yeah.
Dennis, I know of some places that are doing drawings. So if you get the vaccine, then your name
We
gets
talked-
put in
we
for
talked
a
about that
prize. So
too.
then it
Yeah,
keeps
that's a
everybody
great
equal
idea.
weighted.
Yeah. That's a great idea too.
Any other great question, Dennis? Any other questions for Dr. Nielsen?
No, thank
I
you.
have a quick one. Oh, I'm sorry.
go ahead. Go ahead, Destiny.
Sorry. I know that there's probably not an answer for this question, and I know that everyone's asking it right now, but as for planning purposes, do you have any idea when allotments will be going up, or is the federal government giving us any idea on that? We're hearing hopefully soon from KDHE, and hopefully soon is a great answer, but I just thought maybe you had the inside track on that.
You know, I do actually have the inside track, which I hope you all write in your diaries, because this might be the only time I have the inside track. But actually today on a National Governors Association call, and it was just reported in the press, so I guess I'm not really breaking any news, but the federal government is going to be increasing the amount of vaccine they're sending to every state by 16% for each of the next 3 weeks. And from now on, they're going to be giving us a 3-week forecasting window. One of the things that has been so frustrating for folks on the ground is I can't possibly pull together, 1,000 people to get vaccinated in a week's time. A week is just not long enough. So Destiny, I actually had some scoop.
That's great. Thank you. Well, we got a couple more minutes here. Any last questions for Dr. Nielsen or comments that you guys would like to make before we wrap up?
Don, I don't have a question, but just want Marcy to know I was excited to read that you had taken on this role. We're really happy to hear that. Marcy and I go back a ways, and she did a lot of great work years ago and for our state. And so I think you're going to be a great help to us in getting this thing moving in the right direction. So thank you for taking on this role.
Well, that's very kind of you, Bruce, as all my old friends know. Yeah, actually, in addition to whatever work I might do, I believe in trying to have a little bit of fun as we're working hard. We shouldn't take ourselves too seriously, despite how serious this subject is. We all have to take care of each other.
Well, on the good news front, we like to end with a bright spot, and I'll just share one out of Eureka, Kansas, in Greenwood County. We heard earlier today, a patient had fallen and broken her hip at her home and was in the hospital recovering, and mentioned to her nurse that she had a pet she was worried about. And the nurse learned that she had a dog at home, got her keys, and went and, with permission and coordination, got the patient's keys and went and picked up the dog and is boarding the dog at her house until the patient recovers. And so I love that story because it paints, these are really, in a lot of our communities, people taking care of their neighbors and family members and people they've known for a long time. And that sense of community and caring that we're getting from our healthcare systems and the staff of going above and beyond. Just a great chance to catch people bringing kindness and generosity into the world and making it a better place. So thank you all for the work you're doing. And we'll be here next week at 4:30, talk about Southeast Kansas. Here are the websites you can go to. If you need to get tested, go gettested.com/Kansas. You can find a free testing site. We showed you kansasvaccine.gov for vaccine information. If you have comments for us, ksregionalreport@gmail.com. And if you'd like to sign up for the email list, covid.ks.gov/report-outs. There you go. Everybody have a great evening, and we'll see you this time next week.